Okay.
Action. 1, 2, 3, go.
Can you tell us a little bit about your career as a registered nurse?
I was a registered nurse at Buffalo General since 1984. My experience there was in med-surg, discharge planning, UR, psychiatry, dialysis, and my last position was an MRI and CAT scan.
Do you recall when you first noticed symptoms and what you initially thought?
Yes, I've had discomfort in my legs and arms, very painful for about 3 years prior to the diagnosis, but it wasn't showing up in the labs or anything until I had an x-rays done, and there it was in my femur, the multiple myeloma.
And what were the symptoms?
A lot of pain. I thought I had fibromyalgia because it would be in one thigh, then it would be in the other thigh, then it would be in my arm.
And did you take anything for that?
Yes, I took Motrin before work.
And did something happen that caused you to follow up? Did you say you had a cracked rib, or can you
Yeah,
explain that?
what happened is I had an oncologist already because I had thyroid cancer in 1990, and my oncologist felt that it was time to pursue the pain a little further, and that's when she sent me for x-rays, and that's when we found out I had the multiple myeloma. And yes, I did fracture a rib just rolling over in bed one day. It just normally deteriorates your bones.
And did you say that in 1990 you had cancer of the thyroid?
In 1990, I had medullary cancer of the thyroid. And it's not to be connected with multiple myeloma either.
And did you say before that your doctor recommended a bone marrow transplant?
The doctor, as more of a definitive test, we had a bone marrow biopsy done, and once again that showed that I had multiple myeloma because of the changes in plasma cells.
And what did the process include?
Okay, after I was diagnosed, that was 2007, they were preparing me for a bone marrow transplant. So I was given growth factor shots, and then I harvested my stem cells through a pheresis machine. They would take those stem cells and freeze some for future use and some to be used. And then once that was all established and my body was ready, strong enough for a bone marrow biopsy, I had my first one in 2008, which was my own, an auto.
Do you remember your reaction when you first received your diagnosis of multiple myeloma?
Well, at first I thought it was extremely unfair because it was my second bout of cancer. And then I was very scared, obviously, because my children were young, and the death fear, pain fear, all those factors get involved.
So you had initial fears, and anything else?
The fear of the unknown also, but Roswell was fantastic in helping you go through the steps. Everything is explained to you. They take a lot of time with each patient or client, and they have social work. They have any discipline that you may need to get you through this.
Yeah. So you felt pretty comfortable that your concerns, your fears were addressed?
Very much so. They address every fear. There's surveys that you take all the time, and every time you go in, they ask you the same question, but it's important because they want to know whether there's any changes in your psychosomatic situation or whatever.
Good. Can you explain what multiple myeloma is and when you first began treatment?
Multiple myeloma is almost like a form of leukemia where the bad plasma cells eat away at the bone marrow and therefore causing lesions in your bones. And that's why in 2014 my back gave out. I fractured my back, not even falling or anything. So it's a deteriorating type of disease. Along with it, it messes with your lab values, so sometimes you need a transfusion, sometimes you need a little help with all that.
And a little bit with respect to your treatment and how this affected your work at the time?
I tried to be as normal as possible. So after my first transplant and when I became stronger and not able to get infections that easily, I took a job in psychiatry and I worked in psychiatry for a good year and a half until the cancer came back and I needed another transplant, which was in 2010. That one lasted 5 years. The transplant, meaning I went into partial remission in 2010, and so therefore I went back to psychiatry, and then psychiatry closed, so I went to CAT scan MRI, and then in 2014 my back fractured. So therefore I couldn't work anymore, and then in 15, I had another bone marrow transplant, but that lasted only a year and a half. And now the most current was in 2017, and that was my daughter was my donor. So it was a haplo, they call it a haplo, because it was a half match, and it was a donation from my daughter to stem cells.
Can you describe what your early treatment was like?
My early treatment, I would say, was mostly monitoring blood work, getting the bone marrow biopsies, getting me ready for the bone marrow transplant, bone scans, CAT scans, staging. A lot of staging occurred at that time.
And did you notice the difference, like hair loss or anything like that? Or
After the bone marrow transplant, prior to them, we are given chemo, a whopping dose of chemo, and after a while, your hair does fall out. They watch all your cells grow back, so you're kind of like a baby. You're extremely weak. You have to be very careful with bacteria, any kind of colds or anything like that, so you wear a mask afterwards. You can't eat a lot of vegetables, raw vegetables, or eat at a buffet or salads. You follow a low microbial diet when you're discharged after you have a transplant.
At some point, did you go into remission where you were somewhat symptom-free?
Yes, as I said, the first time was after my first transplant, which was a year and a half. The following one was 5 years, and then year and a half, and then now this one in 17. The thing is, with multiple myeloma and remission, it is a form of remission, but you're still sometimes given oral chemotherapy to help keep the plasma cells down. So it is a remission, but it's not always a total remission.
And how long were you able to continue to work after your diagnosis?
I worked off and on. I was diagnosed in 2007. I would say about good 7 years. I was working off and on, going out on disability for the transplants, obviously. And because I am a nurse, I was a nurse, you have to consider patients. You have to make sure that you're not around infectious people.
And then were the type of treatments more like narcotics, Tylenol, that type of thing?
Most people are able to take narcotics for pain. I unfortunately am not. I don't. My body doesn't cooperate with them. I hallucinate more than get the benefits of pain control. So you just have to, see what might work. Like codeine works a little bit, or Tylenol.
And you mentioned BioFreeze, did that help?
BioFreeze, no.
No. Can you describe the volunteer work that you did at St. Pius?
Yes, after I was diagnosed and had my first transplant, I asked my oncologist, I'm so bored here. What should I do? And he says it's time to, maybe you should try to volunteer. So I volunteered at my church, at the Donut Social, and then Ladies of Charity. And I was very fortunate to make a lot of new friends. So it was a great thing.
Great thing. But was there a time then that you could no longer do that?
Yeah, once I was going to have another transplant, I couldn't do it again. Then obviously when I broke my back, I can't lift or stand or sit too long. Then I had to give up the Donut Social, but I try to participate in Ladies of Charity as much as I can.
And how would you say you're doing currently, and can you explain if your treatment stopped at any point or if it restarted? I think you mentioned that.
Unfortunately, my cancer came back since the last transplant, so I'm in full treatment right now, chemotherapy and 2 types of chemos and assistance with my calcium's too high that I have to take meds for that. I get transfusions, blood transfusions every so often. So currently I am in full treatment again.
Any other questions?
Medical marijuana, was that ever tried?
No. When I had the last transplant, I developed graft versus host disease, which is something that most people get if they have a donor for stem cells. And mine settled in my abdomen, so in the internal organs, and so I couldn't eat. So my doctor was trying to prescribe medical marijuana for me to enhance my my diet, but the insurance company wasn't going to approve it. So therefore I never had it. But as I told my doctor, I have a history of being thin and fat, so I wasn't okay. So I was lucky with some steroids. The graft versus host disease went away after a couple months.
But you mentioned Our Ladies of Charity as far as volunteer work and other things that were motivational for you. Is there any other things you would recommend if anybody was going through treatment?
I would recommend getting involved. There's a lot of programs at Roswell that you could be a chemo coach. You could, as long as you're away from most diseases, it would be good, like maybe a senior center. Currently, I am not volunteering because the chemo I get twice a week, and then I go to Roswell once a week. So there's 3 days that are full of doctor visits. So at this point, I cannot volunteer, but I'm looking forward to it again soon.
And the chemo treatments, are they locally or?
Yes, the chemo treatments are at a local oncologist in Williamsville. I could get those at Roswell, but because I already was linked with the oncologist because of my thyroid cancer, they said that I should go to the local doctor right now. But also, I see Roswell once a week, so they're monitoring me.
Is there anything different in your treatment since when you were first diagnosed in 2007 until now? Any advancements or anything, any different in procedure?
There have been great advancements in this multiple myeloma situation. When I was first diagnosed, they harvested my stem cells and they said, we only have enough stem cells for, I think they said at the time, 2 transplants. And then when I needed my third one, we were able to harvest more stem cells, which was like a miracle because at one point it wasn't going to be a possibility. So yes, there are many, many advances, new meds, biologics, more like, instead of using chemo, there's a lot of advances. And my oncologist at Roswell says there's a lot more coming in the summertime.
And the immunotherapy program?
That's the biologic, and I get that medication infused in me along with the chemo at the local oncologist in Williamsville.